Once addiction gets triggered, you can't just unwind it and go back.
During the pandemic, Canadians started drinking more alcohol, and it's a habit that many have stuck with. But it might be time to put the drink down and stop alcohol addiction before it becomes a severe problem.
Being in part of a global pandemic seems to push them over that line from kind of problematic use to more compulsive or dependent use.
Abbott says despite best intentions or hopes, it can be incredibly difficult to reduce the bad habit without professional help, advising people to check in with their usage before it goes too far.
Almost like the dental model of checking things up, like go and get your teeth cleaned, go and get your mental health checked up on before your teeth are hurting or you have a cavity. Same thing with your mental health, but the earlier is always the better.
Research from the University of Calgary found a link between the pandemic and a rise in alcohol-related liver disease.
In the first year of the pandemic, alcohol-related hepatitis admissions actually more than doubled compared to the rates we were seeing pre-pandemic.
Even as social restrictions lifted, Albertans were still being hospitalized at an increased rate, and the median age dropped from 48 to 44.
To see the median age of admission decline is really concerning for us. We never want to see a younger population admitted into the hospital for any reason.
Bagley says they're now working on the next steps to identify and manage risk of liver disease early on. And there is a silver lining with the younger generation seeking help.
There's actually a lot more youth, so in kind of that 18 to 25-year-old age group, who are seeking out recovery, pursuing abstinence from alcohol and other drugs and substances.
In Calgary, Jillian Code, City News.